As women age, especially after 60, the body goes through natural physiological changes, and the respiratory system is no exception. These changes can significantly influence why older women may experience persistent coughing and mucus buildup. One of the key changes is the loss of elasticity in lung tissues. In younger individuals, the lungs expand and contract with ease, allowing for efficient air exchange and clearance of mucus. However, with age, the elasticity of the alveoli, tiny air sacs in the lungs, decreases, making it harder for the lungs to push mucus out. This can lead to mucus lingering in the airways, triggering a cough reflex. Another factor is the weakening of the respiratory muscles. The diaphragm and intercostal muscles, which play a vital role in breathing, lose strength over time. This means that the force of a cough becomes less powerful, making it more difficult to clear phlegm effectively. This is why older women may feel they have to cough repeatedly to expel mucus. The lining of the respiratory tract also undergoes changes. The cilia, tiny hair-like structures in the airways, are responsible for sweeping out dust, microbes, and mucus. With aging, cilia movement slows down, reducing the efficiency of mucus clearance. This slowdown means mucus remains in the lungs and throat for longer periods, which can encourage bacterial growth and lead to more frequent infections. In addition, age-related changes in the immune system, known as immunosenescence, make it harder to fight off infections that can cause or worsen mucus production. Even minor irritations like seasonal allergies or a mild cold can lead to prolonged coughing episodes, because the body takes longer to recover. Hormonal changes post-menopause may also indirectly impact the respiratory system. The drop in estrogen levels can influence mucous membrane hydration, sometimes making mucus thicker and stickier, which is more difficult to expel. Environmental exposures accumulated over a lifetime, such as pollution, secondhand smoke, or workplace chemicals, can further damage lung tissue. This long-term exposure compounds the natural age-related decline, leaving older women more vulnerable to chronic respiratory symptoms. Lastly, the nervous system's sensitivity to irritants changes with age. In some older adults, the cough reflex becomes overly sensitive, meaning even small amounts of mucus or dust can trigger coughing. In others, the reflex weakens, allowing mucus to accumulate before a cough is stimulated. Both scenarios can lead to a constant feeling of needing to clear the throat. Overall, these age-related changes, loss of lung elasticity, weaker muscles, slower cilia function, and reduced immune defense, combine to make daily mucus buildup a common issue for older women. Understanding these changes is the first step toward adopting preventive measures and natural remedies that help maintain respiratory health. After the age of 60, the immune system naturally becomes less efficient, a process known as immune. This gradual decline affects both the speed and strength of the body's immune responses, making it harder to fend off respiratory infections, heal from illnesses, and maintain a clean, mucus-free airway. For older women, this weakened immunity can be a major reason behind persistent mucus production and daily coughing. When the immune system is strong, it can quickly detect and fight off viruses, bacteria, and irritants in the respiratory tract. In older adults, however, immune cells such as white blood cells and antibodies may respond more slowly or in smaller numbers. This means even minor respiratory infections, like a common cold, can linger longer and cause prolonged mucus buildup. Another aspect is the chronic low-grade inflammation common in older adults, sometimes referred to as inflammaging. This constant mild inflammation can irritate the lining of the airways, stimulating excess mucus production. Instead of being thin and easy to expel, this mucus is often thicker and more stubborn, further slowing clearance. Slower mucus clearance is also tied to the reduced efficiency of cilia, the tiny hair-like structures that sweep mucus and debris up and out of the airways. Aging causes cilia to beat more slowly, so mucus stays trapped in the lungs and bronchi for longer periods. The longer mucus sits in the respiratory tract, the more it can attract bacteria, leading to repeated or chronic infections. The weakened immune system also affects the body's ability to produce high-quality antibodies. In younger people, these antibodies not only attack pathogens, but also help regulate the inflammatory process, preventing overproduction of mucus. In older adults, this regulation is less precise, often resulting in mucus being produced, even when it's not strictly necessary. Essentially, the body's defense system, MISFIRES. Compounding the issue, certain chronic conditions that become more common with age, such as diabetes, heart disease, and chronic obstructive pulmonary disease, COPD, can further impair immune function. Medications used to treat these conditions, such as steroids or certain blood pressure drugs, may also have side effects that impact mucus consistency or immune responsiveness. Lifestyle factors play a role too. Poor nutrition, dehydration, lack of physical activity, and chronic stress can all reduce immune efficiency and slow mucus clearance. For example, dehydration thickens mucus, making it harder for cilia to move it out of the airways. Similarly, low levels of certain vitamins and minerals, especially vitamin C, vitamin D, and zinc, can hinder immune function. All of these factors slower immune responses. Chronic inflammation, reduced cilia action, and lifestyle habits create a cycle where mucus lingers in the airways, irritating throat and lung tissue, which then produces even more mucus in response. For older women, the key to breaking this cycle lies in boosting immunity naturally, maintaining hydration, eating nutrient-rich foods, staying physically active, and practicing good air quality habits. Combined with natural mucus-thinning remedies like steam inhalation, these strategies can help restore balance to the respiratory system and reduce daily coughing episodes. As women age, the likelihood of developing chronic respiratory conditions, such as chronic bronchitis or chronic obstructive pulmonary disease (COPD), increases, especially for those with a history of smoking, long-term exposure to pollution, or repeated respiratory infections. These conditions are among the most common causes of persistent coughing and daily mucus buildup in older adults. Chronic bronchitis is a long-term inflammation of the bronchial tubes, the airways that carry air to and from the lungs. This inflammation irritates the lining of the airways, prompting the body to produce excessive mucus as a protective mechanism. However, in chronic bronchitis, the mucus is often thick and difficult to expel, resulting in a lingering cough. In older women, weakened respiratory muscles and slower cilia function make it even harder to clear this mucus, which can lead to a constant feeling of congestion. COPD, which includes both chronic bronchitis and emphysema, is characterized by airflow limitation and lung damage. In emphysema, the tiny air sacs alveoli in the lungs are destroyed over time, reducing the surface area available for oxygen exchange. This damage, combined with chronic inflammation, increases mucus production. COPD also makes breathing more difficult, so coughing up mucus can feel exhausting, leading many older women to experience a near-constant cough that disrupts daily activities and sleep. One reason these conditions become more problematic after 60 is that lung tissue repair slows down with age. In younger individuals, the body can repair minor airway damage relatively quickly. In older adults, however, the healing process is slower, and repeated irritation or infection can cause lasting changes in the airways. Over time, this leads to a vicious cycle. Inflammation produces mucus. Mucus traps irritants and pathogens, and these trapped irritants cause more inflammation. In addition, chronic respiratory conditions can weaken the immune system's local defenses in the lungs. This means bacteria and viruses can survive longer in the mucus, increasing the risk of secondary infections like pneumonia. For older women, even a mild infection can cause symptoms to worsen dramatically. Environmental factors also play a big role. Long-term exposure to polluted air, chemical fumes, dust, or secondhand smoke can cause or exacerbate these conditions. Older women who spent years in environments with poor air quality, whether in cities, certain workplaces, or kitchens with smoke from cooking fires, may see the effects appear or worsen later in life. The daily impact of chronic bronchitis and COPD is not just physical but emotional. Constant coughing can cause embarrassment in social situations, while the struggle to breathe can lead to anxiety or reduced activity levels. Unfortunately, less activity can further weaken lung function and muscle strength, worsening the condition. Over time, natural management strategies, while not a replacement for medical care, can help reduce mucus and improve breathing. Staying hydrated, practicing gentle breathing exercises, avoiding irritants, eating anti-inflammatory foods, and using steam therapy can help thin mucus and make coughing more productive. Early detection and consistent management are crucial, as chronic conditions can be slowed, though not reversed, when addressed promptly. Postnasal drip is one of the most common yet overlooked reasons older women experience daily mucus buildup and coughing, especially after the age of 60. It occurs when the glands in the nose and sinuses produce excessive mucus, which then drips down the back of the throat instead of coming out through the nose. This constant trickle irritates the throat. After menopause, women experience a significant drop in estrogen and progesterone levels, which affects many systems in the body, including the respiratory tract. While these hormonal changes are well known for influencing bone density, skin, elasticity, and mood, they also play a subtle yet important role in mucus production and respiratory health. This hormonal shift is one reason many older women begin to notice increased mucus buildup and persistent coughing after 60. Estrogen's role in mucus regulation is often underestimated. In the respiratory tract, estrogen helps maintain the health and hydration of mucous membranes. When estrogen levels decline, these membranes can become drier and less efficient at producing the right consistency of mucus. This dryness can cause the body to overcompensate by producing thicker mucus in an attempt to keep the airways moist. Unfortunately, thicker mucus is harder to clear, leading to a constant sensation of phlegm in the throat. Progesterone, another hormone that declines after menopause, has a calming effect on inflammation. Lower progesterone can contribute to increased sensitivity of the respiratory tract, making it react more strongly to irritants like dust, pollen, or cold air. This heightened sensitivity can lead to more frequent mucus production, even from mild triggers that previously went unnoticed. Hormonal changes also affect the immune system's regulation of mucus production. Estrogen, in particular, helps modulate immune responses, keeping inflammation under control. After menopause, without this balancing effect, inflammatory processes may become more active, prompting excess mucus as part of the body's defense mechanism. This is why postmenopausal women are sometimes more prone to lingering coughs after respiratory infections. Another factor is the impact of hormonal changes on hydration. Lower estrogen levels can cause a general decrease in body hydration. Because estrogen influences fluid retention and distribution, this means mucus can become stickier. And the cilia, the tiny hair-like structures that help move mucus out of the respiratory tract, struggle to sweep it away efficiently. In some cases, menopause-related changes in acid reflux GERD can indirectly increase mucus production. Hormonal shifts can relax the lower esophageal sphincter, allowing stomach acid to irritate the throat and airways. The body responds to this irritation by producing more mucus, creating a persistent cough and throat clearing. Managing mucus production related to hormonal changes requires a holistic approach, staying well hydrated, eating foods rich in phytoestrogens such as soy, flax seeds, and chickpeas, and using natural anti-inflammatories like turmeric and ginger can help balance mucus production. Breathing exercises and light aerobic activity can strengthen the respiratory system, improving mucus clearance. For dryness, using a humidifier indoors can keep airways comfortable. While hormonal changes are a natural part of aging, understanding their impact on the respiratory system empowers women to take proactive steps. With the right lifestyle adjustments and natural remedies, it's possible to minimize excessive mucus production, reduce coughing, and maintain comfortable breathing well into the senior years. Environmental triggers are one of the most common and persistent causes of daily mucus production and coughing in older women. After the age of 60, the respiratory system becomes more sensitive to irritants in the air due to age-related changes in lung tissue, reduced cilia efficiency, and weaker immune defenses. Even small amounts of allergens, smoke, or pollution can provoke significant mucus buildup, making it difficult to breathe comfortably. Allergens such as dust mites, pollen, mold spores, and pet dander are frequent culprits. Inhaled allergens irritate the lining of the nasal passages, throat, and lungs, triggering the body's immune response. This immune reaction causes inflammation and stimulates mucus-producing glands to release more mucus in an attempt to trap and remove the irritants. In older women, this process can be exaggerated because the airways may already be inflamed from age-related changes or previous respiratory illnesses. Smoke, whether from cigarettes, secondhand exposure, wood-burning stoves, or even cooking fumes, can be particularly harmful. Smoke contains tiny particles and chemicals that directly irritate the airways, damage cilia, and trigger mucus overproduction. Long-term smoke exposure, even at low levels, can lead to chronic bronchitis or other respiratory conditions that cause daily coughing. For older adults who grew up in eras when smoking was more common or who spent years around indoor stoves without proper ventilation, the cumulative effect can be substantial. Air pollution is another serious factor. Tiny particulate matter PM 2.5, nitrogen dioxide, and other pollutants can penetrate deep into the lungs, causing inflammation and stimulating excess mucus production. Urban areas with heavy traffic, industrial zones, or poor air quality can worsen symptoms. Older women may notice that their coughing and mucus production increase on days with high pollution or during certain seasons, such as winter, when air tends to trap pollutants closer to the ground. Indoor air quality can also play a big role. Poor ventilation, chemical cleaning products, scented candles, and even certain air fresheners can release volatile organic compounds (VOCs) that irritate the airways. Over time, this constant exposure can make the respiratory tract hypersensitive, leading to chronic mucus buildup. Managing environmental triggers involves both avoidance and proactive protection. Simple measures such as keeping windows closed during high pollen days, using high-efficiency particulate air HEPA filters, vacuuming with HEPA-equipped cleaners, and avoiding harsh cleaning chemicals can greatly reduce indoor allergen and pollutant exposure. For smoke, avoiding smoking areas, ensuring good kitchen ventilation, and using exhaust fans can help minimize contact with harmful particles. Wearing a well-fitted mask in polluted or dusty environments, especially during outdoor activities, can reduce the amount of irritants entering the lungs. Drinking plenty of fluids and using saline nasal rinses can also help wash out inhaled particles before they trigger a strong mucus response. For older women, reducing environmental irritant exposure can significantly decrease daily mucus buildup, make breathing easier, and lower the risk of developing chronic respiratory conditions. The key lies in recognizing triggers and making consistent, small changes to improve the air quality around them. For older women who experience daily coughing and mucus buildup, natural remedies can be an effective way to manage symptoms without heavily relying on medications. While age-related changes in the respiratory system can make mucus production more persistent, there are many gentle, non-invasive strategies that can thin mucus, improve clearance, and reduce irritation in the airways. One of the simplest and most powerful remedies is staying well hydrated. Water helps keep mucus thin and easier to expel. Dehydration, which is more common in older adults, makes mucus thick, sticky, and harder to move. Drinking 6 to 8 glasses of water daily along with herbal teas, broths, and fresh juice make a noticeable difference in mucus consistency. Steam inhalation is another traditional remedy that works well. Inhaling warm, moist air helps loosen mucus and soothe irritated airways. This can be done by leaning over a bowl of hot water with a towel over the head, adding a few drops of eucalyptus or peppermint essential oil for added relief. Regular hot showers can also provide similar benefits. Saline nasal rinses or sprays, such as those used in a neti pot, help flush out allergens, dust, and excess mucus from the nasal passages before it drips into the throat. For older women dealing with postnasal drip, daily saline rinsing can prevent mucus buildup and reduce the constant urge to cough or clear the throat. Certain herbal and natural anti-inflammatory ingredients can help reduce mucus production and support respiratory health. Ginger, turmeric, and garlic are well known for their anti-inflammatory and antimicrobial properties. Honey, especially raw honey, can soothe throat irritation and act as a natural cough suppressant. A warm drink made with honey, lemon, and ginger is a simple yet effective home remedy. Dietary choices also play a role. Reducing dairy intake may help some people, as dairy products can sometimes make mucus thicker. On the other hand, increasing intake of antioxidant fruits and vegetables can strengthen the immune system and reduce inflammation in the respiratory tract. Pineapple, which contains the enzyme bromelain, is particularly helpful in breaking down mucus. Maintaining optimal indoor air humidity is essential. Dry air can irritate the airways and make mucus thicker, while overly humid environments can encourage mold growth, another mucus trigger. Using a humidifier in winter or in dry climates can help keep airways comfortable. Breathing exercises and gentle physical activity can also aid mucus clearance. Techniques such as pursed-lip breathing or controlled coughing can strengthen respiratory muscles and help expel mucus more effectively. Even light exercise like walking can stimulate lung function and improve circulation, which helps the body fight inflammation. These natural remedies are not only effective for symptom relief but also promote long-term respiratory health. The key is consistency. Integrating these practices into daily life can gradually reduce mucus buildup, make coughing less frequent, and improve breathing comfort for older women. For older women experiencing daily coughing and mucus buildup, making long-term lifestyle adjustments can be one of the most powerful ways